Good afternoon. I'm going to be being joined by Dr. Dina Hinshaw, Chief Medical Officer of Health for Alberta, and Minister of Health Tyler Shandro, with our daily update on COVID-19. In our province and across Canada and around the world, the number of novel coronavirus infections and fatalities continues to rise. Before I get to Alberta's numbers, I'd like to try to alleviate some of the anxiety we're all feeling by sharing some modestly encouraging data. As of today, March 25th, there are about 440,000 reported cases of infection around the world. While there have been nearly 20,000 deaths attributed to the virus, the Johns Hopkins Center for Systems Science is also reporting 112,000 recovered cases. And the vast majority of infected patients exhibit mild or, in many cases, no symptoms. We are starting to record recoveries from COVID-19 here in Alberta and across Canada. Yesterday, British Columbia reported that 173 patients, nearly a third of the total number of infected, have fully recovered. Moreover, countries like South Korea, Singapore, Taiwan, Hong Kong, and Japan, which implemented strong countermeasures early in the outbreak, have been very successful in containing the rate of new infections. So the evidence strongly points to a dangerous but manageable public health crisis. Thanks to excellent pandemic planning and swift action by Dr. Hinshaw and her public health team at Alberta Health, together with the great healthcare teams at Alberta Health Services, we're managing the early stages of the outbreak in Alberta effectively, much more effectively than in many other jurisdictions around the world. The best measure of Alberta's response is that we currently rank fourth in world per capita testing, that is to say the fourth highest in the world on a per capita level for the incidence of testing. That said, the number of confirmed cases in Alberta has risen by 61 over the last 24 hours, bringing the total number of confirmed infections to 419. Early this month, we launched a series of aggressive public health measures to limit the spread of the virus, including restrictions on mass gatherings, closure of many facilities, and restricting capacity at restaurants and other food service locations. Recognizing that international travel was a primary vector for transmission in the early stages of this pandemic, we moved to augment federal efforts to screen passengers at our major airports. Many of these actions were supported by invoking a state of public health emergency under the Public Health Act. Municipal governments and First Nations have been doing their part to support these containment efforts, and I'd like to thank mayors, councillors, First Nations chief, and administrators across the province for their good work. We strengthened this intergovernmental partnership by passing amendments to the Emergency Management Act, allowing local and provincial states of emergency to exist at the same time, helping communities and the province to respond more effectively to the pandemic. We've also partnered with municipalities and charities to expand shelter, assessment, and treatment capacity for the homeless who are uniquely at risk during the crisis. Yesterday, I visited Hope Mission here in Edmonton, the largest homeless shelter in northern Alberta, and saw their good work. With the additional funding we provided them, they are setting up overflow shelters today, and an additional overflow shelter being set up at the Expo Centre, together with the overflow shelters being established in Calgary and other cities around the province. And I can tell you this is a matter of particular focus for the Emergency Management Committee of Cabinet. At every meeting, we are discussing what more action needs to be taken to help protect that uniquely vulnerable population. The legislature passed the 2020 budget in record time so that we have now more than $21 billion to support our healthcare system, including the additional $500 million specifically for COVID-19 response. We also introduced new billing codes for doctors so they can do more virtual visits with their patients, as well as a new billing code for pharmacists to allow them to take on a bigger role in screening for the virus. Underlying all of these efforts has been a systematic effort by Alberta Health Services to ramp up the capacity of our healthcare system to deal with the projected increase of hospitalizations. This includes marshalling all available personnel and vast amounts of supplies, including personal protective equipment and ventilators, and increasing availability of childcare spaces for workers, providing core healthcare and other services. And let me just add that while AHS has been very forward-looking well before this in developing large stockpiles of critical equipment and supplies, we have tasked the Alberta Emergency Management Agency, now operating out of the Provincial Operations Centre, with coordinating the procurement of additional supplies to be shared with people working in essential services outside the healthcare system itself. So that would include staff at homeless shelters, police officers, correctional officers, and people in other essential services. There is also ongoing work on defining critical infrastructure and essential services. We'll have more news on that front later this week. I should say that today I'm pleased to be here with Dr. Hinshaw to announce further measures to contain the spread of COVID-19. The overwhelming majority of Albertans have been very responsible and civic-minded in responding to this crisis. Most of us understand that we all have a role to play in limiting the spread of the disease by staying at home as much as possible, practicing rigorous personal hygiene, maintaining a safe distance from other people, and respecting the restrictions that have been put in place to limit social interaction. But sadly, not everyone seems to get it. Too many people continue to ignore these guidelines that have been issued by Dr. Hinshaw and the Government of Alberta. As I said before, too many people are ignoring our public health guidelines, and in so doing, they endanger the health of others, particularly the most vulnerable. So, today we are moving from asking people to act responsibly to instead using the full force of the law to legally that require that people act responsibly to protect public health. Through amendments to the procedures regulation under the Provincial Offences Procedures Act, community peace officers, in addition to police, will now be able to issue tickets to enforce COVID-19 public health orders. These provisions include the current limit on mass gatherings to 50 attendees, and mandatory self-isolation for people in the following circumstances: any individual diagnosed with COVID-19 or exhibiting the symptoms of COVID-19, such as cough and fever, anyone returning to Alberta from outside of Canada, and all of those who have had close contact with an individual who is confirmed or probable case of COVID-19. To be clear, returning international travelers must self-isolate for 14 days, or they will be subject to the newly imposed significant penalties. All others, including confirmed or probable cases of COVID infection and those in contact with confirmed or probable cases, must self-isolate for at least 10 days. These legally binding rules include operational daycares, except for those for whom we are making exceptions to support critical care workers and core service workers, public recreational facilities, bars and nightclubs, and non-essential visits to continuing care and long-term care facilities. So if you violate the rules that we have laid down, you will now be subject to stringent penalties and fines with rigorous enforcement behind them. To drive home the importance of everyone adhering to these laws for the protection of public health, community peace officers and police will be able to issue fines of up to $1,000 per violation through tickets. We are consulting with municipalities as well on the possibility of expanding these enforcement powers to municipal bylaw officers. Courts will also have increased powers to administer fines of up to $100,000 for a first offence and up to $500,000 for a subsequent offence or for more serious violations. These new fines will be enforced over the coming days. These new enforcement measures are a reasonable, prudent, but necessary response to the escalating COVID-19 outbreak in Alberta. These powers are being enforced through a ministerial order under the public health emergency, but we will be coming to the legislature in the near future to seek to actually make the necessary amendments on a permanent basis. When life returns to normal, we will no longer require these kinds of extraordinary powers, but right now we must use every tool available to ensure public safety. And with that, we'll hear from Dr. Hinshaw.
Thank you, Premier. Good afternoon. Thank you all for coming. As Premier indicated, since yesterday's update, we have confirmed 61 new cases of COVID-19. This means 419 cases have now been identified in our province. We suspect up to 33 of the 419 cases may be community transmission, which is 5 more than we talked about yesterday. Currently, 20 individuals are hospitalized, of whom 8 are in the ICU. These are significant case numbers, and they underscore the seriousness of the situation that we face. Late last night, we learned of an outbreak of COVID-19 at an adult group home for people with developmental disabilities. So far, 1 staff and 2 residents have tested positive. We are also aware of 9 cases to date in staff and residents of long-term care or other continuing care facilities. This includes the 4 previously reported plus 2 additional cases at the Mackenzie Town facility in Calgary, as well as 1 case in Rosedale on the Park and 2 at Shepherd's Care Kensington Village in Edmonton Zone. I know that many Albertans are concerned about these cases and about the spread of COVID-19. I am concerned as well, which is why, as Premier Kenney has outlined, public health orders will now be enforced by law. This step is essential to protect the health and safety of Albertans. Alberta's enforcement of public health orders is in addition to the decision of the federal government to implement a mandatory 14-day quarantine under the Quarantine Act for travellers returning to Canada. This step is serious and it is necessary. We must do everything possible to stop the spread of COVID-19, to support our healthcare workers, and to keep our family, friends, neighbours, and vulnerable Albertans safe. As I have previously mentioned, people living in long-term care and other continuing care facilities are most at risk of severe illness from this virus. Over the past 2 days, despite the aggressive measures already in place, it's become clear that additional measures are needed. It is up to all of us to do everything we can to prevent the spread of this virus and to keep vulnerable populations safe. This is one reason for the enforcement of the public health orders. In addition, we restricted access last week to these facilities to only essential visitors, all of whom must undergo health screening prior to entering. The Ministry of Community and Social Services has communicated with the Alberta Council of Disability Services that this also applies to licensed facilities for persons with disabilities. Today, I am ordering additional directions that all healthcare operators and service providers must follow. Facilities under this order include all nursing homes, designated supportive living and long-term care facilities, seniors' lodges, and any facility in which residential addiction treatment services are offered under the Mental Health Services Protection Act. These new guidelines are mandatory. They will help keep those living and working in congregate settings as safe as possible. This includes new expectations that every facility must follow enhanced cleaning and additional directions around the use of shared spaces and common activities. They also outline mandatory health screening protocols for all staff, residents, and essential visitors entering a facility. An updated operational standards document will be made available on the COVID-19 webpage shortly and will also be distributed to service providers and operators. As new cases arise, I know that some Albertans may be feeling tired of the constant barrage of information, and they may be wondering what more they can do. The answer is simple. We must all do everything possible to follow all public health recommendations in place. All of us have a role and a responsibility to stop the spread, and there are actions that all of us can take. These extend to our homes, our families, and our traditions. For example, we need to limit sharing of open food, even between family members. Don't share snacks like a family popcorn bowl, open candy, nuts, or other snacks like this. Limit the availability of a communal fruit bowl. Don't share cups, drinks, or utensils, and have one person as the designated person to serve all others so that a serving utensil is handled only by one person. This direction became abundantly clear following the Edmonton Bonspiel, where almost half of Alberta healthcare workers in attendance have tested positive for COVID. We suspect the virus was spread at a buffet where serving spoons were handled by many people. I know it might seem strange to limit these activities in your own home. However, this is important modeling that we as parents can share with our children, and it is another step that we can take to keep each other safe. Wash your hands, disinfect surfaces often. Include this in your daily household routine and make it part of the new normal for your children also. I know many Albertans are now at home with kids or working from home. These are big changes for everyone, and you may start to feel closed in. Families may need to find creative ways to keep children occupied. One suggestion is to partner with a cohort family, where both families agree to isolate from everyone else and to focus on supporting each other. By doing this, the two families would only be exposed to each other, limiting close contacts. Children would have opportunities to play in a controlled environment, and parents would have opportunities to connect. I must be clear, this only works if both families are completely committed, and as long as members in both families remain healthy, don't have underlying medical conditions, aren't at high risk like seniors, have not recently traveled outside of the country, and are not showing any symptoms. Another change we need to make is in our traditions. There are several significant religious and cultural holidays approaching, such as Easter and Ramadan. Yesterday, I had the opportunity to talk to provincial faith leaders about how plans for these celebrations will need to change. Now is not the time to plan any travel, even to other cities or provinces, or to attend large family gatherings or dinners. We must maintain social distancing practices, even when we are together with family. Now is not the time to visit grandparents for Sunday dinner. Now is not the time to host or attend a potluck with friends. Now is not the time to plan for a family reunion. This is the time to stay home and work together to limit the spread. Please practice good hygiene and keep 2 meters between you and others. Many families and groups of friends have been using shared video chat to stay in touch while at home. This is a great way to connect. If you have been using any other ways to connect remotely with family or friends that you want to share with others, please share them with the Alberta Cares hashtag so we can all learn from each other the creative ways we can stay socially connected while physically distant. As I've said before, we will get through this together, even if for now we have to stay far apart. Thank you, and I'm happy to take questions.
Go ahead, Dean.
Premier, can I ask you to supplement your comments on the fine specific? I appreciate you're probably still working some of this out, but how would it work for subsequent offenses and playing it out? What do you do if somebody gets fined and he still continues to reoffend?
I'm going to defer actually to Minister Chandra, because not only is the order issued under his authority, but he's also a lawyer.
Thanks, Premier. It would be similar to the offences and penalty scheme under the Safety Codes Act. So the first offence would have a maximum of $100,000. Subsequent ones could be higher. It'd be to the discretion of the court. So for subsequent offences, it'd be a maximum of $500,000. But it'd be very similar to if somebody faced a penalty under the Safety Codes Act.
Sorry, just to clarify, what do you do if someone just will not, you find them and they still are out there, not keeping their distance?
Well, so we are under a state of public health emergency, and so if that came to that situation, then I would be consulting Dr. Hinshaw to see what other recommendations she recommended for either me or her to be taking with an individual like that, and whether it was, but it would take consultation with Dr. Hinshaw at that point.
Julia?
This is probably for the Premier. How will these community peace officers and police know if this individual is breaking self-isolation if they had just come back from being outside of the country?
Again, I'll defer to the Minister.
Sorry, the question one more time.
How would they know
How-
if they just come back from the country or not?
Yeah, and would be setting up some kind of hotline for people to be calling in tips then?
So there is actually already a hotline of sorts, if that's the word you want to use. AHS, all of our public health inspectors are employees of AHS. So, and right now, the system is complaints driven. So when somebody makes a complaint, then a public health inspector goes and investigates and decides whether or not to impose a fine or some other, measure. Right now, they do receive about 1,600 complaints a day. Part of the reason why we wanted to take these steps today is to be able to make sure that it's not just public health inspectors that we are relying on to be able to investigate, but also including, for example, the level 1 community peace officers as well, because they have the training to also be able to do this.
Go ahead.
And sorry, Minister, just to clarify.
Could I just say, I don't expect that police officers are going to come up and interrogate whether somebody just came back to the country or not. But I think the more likely scenario where these powers would be used is if a group of more than 50 people springs up in a park, let's say, the weather gets better, and suddenly you see pop-up picnics with several dozen people. Then the peace officers could go and break up such an event, and if necessary, issue fines. So again, this is not an effort to start interrogating people based on how long they've been in the country, but it does hopefully send a message. That's really what we're trying to do here, send a message. This is not a hint, it's not a suggestion. It is an absolute legal requirement that under certain circumstances people must isolate themselves.
This is probably for the Minister as well. Just a little clarification on the fines. I heard the Premier mention fines of $1,000, but also the court can add fines of $100,000 or $500,000. Is the $1,000 fines for like individual Albertans, and the higher fines are for businesses caught open bars, for example, that sort of thing?
I think that's exactly right. So what we've done is we've added 3 measures. One is we're allowing the level 1 community peace officers to also supplement the work that the public health inspectors are doing. The second is, because the Public Health Act doesn't include it right now, adding the idea of an administrative monetary penalty as well, so similar as a traffic fine. And so it'd be similar to if an infraction or contravention of the Act was significant enough or severe enough, same as the Traffic Safety Act, there might be a more significant consequence where you'd actually have to go to court and be mandatory attendance. And that's where the more significant fines would be. But now we also allow the discretion of a public health inspector or these CPOs to be able to also have it in their toolbox, these administrative monetary penalties.
We'll go to the phones. Operator, can you put through the first caller, please?
First question is from Terry Reith with CBC. Terry, go ahead.
Yes, hi, thank you. I believe the Premier could perhaps address this, and Dr. Hinshaw, if you want to throw in. It's related to the supply of ventilators in Alberta. And I'd like to know if we're satisfied that we have enough ventilators. And the federal minister has been musing that perhaps supplies and equipment such as ventilators can be centralized and then sent to the areas where they are needed the most. And I'm wondering how that might fly in Alberta, whether that's an acceptable solution.
Well, first of all, we've been briefed that by Alberta Health Services that they have roughly 580 ventilators available in the system. That includes specifically ventilators for children. There are an additional 50 that are on order from an order that was made when the coronavirus first began to manifest in China. And we are briefed by AHS. They believe that we have an adequate number of ventilators to cope with the anticipated peak of the infection when that occurs. However, in an excess of caution, we are working with the federal and other provincial governments to see if we can source additional ventilators. As you know, there have been efforts in Ontario, for example, to get manufacturers to convert to the production of ventilators, and efforts to have companies that produce these kinds of ventilators to open up their patents for extraordinary production on a limited basis. So we are in discussions with both the Public Health Agency of Canada and with other provinces to pursue that possibility of sourcing additional ventilators and other kinds of equipment like personal protection equipment, again in an excess of caution. Listen, we need the equipment that we have in Alberta for Albertans. And obviously, if we were to get down the road here and find that we have excess capacity, we would consider sharing some of that capacity with other provinces, but only after we can be absolutely certain that we are fulfilling the requirements of the Alberta Health Services. Would you like to complement that at all, Doctor?
Thank you, Premier. I completely endorse the comments you've just made. I would add that although there is a focus on equipment, and people love to ask about how many ventilators do we have, equally important is we need to be sure that we have the space in order to house individuals who are critically ill. And Alberta Health Services has been working for some time to ensure that we will have adequate space as the need arises. And most importantly of all, we need to be sure that we have adequate trained staff, because ultimately having a shiny machine in the corner doesn't help you if you don't have adequate trained staff who can provide the direct care that's needed to that critically ill individual, and as well as to maintain the ventilator. So we're working on all aspects of that response plan.
Operator, can you please put through the next caller?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi there. I do have a question and then a follow-up. The first question is for Dr. Hinshaw. I'm wondering specifically for divorced parents who share custody of a child. Can the child go back and forth between homes, say, 1 week with one family and 1 week with another family, or is there a sort of protocol in place?
So that's a good question. We know that many families are in different situations, and shared custody is very common. So certainly the comments that I made about having families that decide to work together with each other to be a kind of common isolating group, that would encompass those kinds of shared custody arrangements. Certainly I would not say that this current situation means that parents or children would need to choose which household they stay in. So these recommendations would not impede any of those kinds of shared custody arrangements. But families in that situation obviously then need to think about how they are containing the number of people in total that their children and their families are in contact with.
Operator, can you please put through the next caller?
Follow-up?
No follow-ups today.
Next question is David Staples with the Edmonton Journal.
Hello there. A country like Taiwan is doing well so far in terms of limiting the spread of the disease, as well as keeping life going on as normal. For instance, kids going to schools. And I'm wondering if where we are in terms of production of face masks. In Taiwan, they make 10 million a day. And I'm wondering from Dr. Hinshaw, how effective are everyone wearing face masks? How effective would that be?
So I can comment on the second part, but I wouldn't be able to comment on our local ability to produce face masks. So what we know from best available evidence is that face masks are really effective when someone who is sick is wearing them to prevent spread of illness to others. And we know that in workplace settings where someone is needing to provide close care, especially in healthcare, to someone who's sick, a face mask, when it's combined with all the other appropriate personal protective equipment and measures that limit the spread of infection from one person to another, that is also effective. But what we've seen from studies in previous occasions, so whether that's the previous pandemic in 2009 or in SARS, is that if you wear a face mask alone while you're well and just out and about, it doesn't seem to add a great deal of protection over and above regular hand washing and avoiding touching your face with unwashed hands. And in fact, if people are wearing face masks in a way that is not correct, so say that they're putting a face mask on with unwashed hands or taking it off with unwashed hands, they can actually contaminate themselves and potentially cause more risk. So it really depends on how face masks are worn. And again, the recommendation is that people who are sick should wear those to prevent spread to others. And in healthcare or workplace settings, again, appropriate personal protective equipment, not the mask alone, but the entire suite of precautions is necessary. And then I might look to someone else to speak about manufacturing capacity.
Well, as I said earlier about ventilators, David, we are making an effort to source all kinds of equipment. I want to commend AHS for having been very well prepared for an event of this nature with a very large stockpile of equipment, including PPE, including face masks, for our medical professionals. But obviously what we're seeing is a great demand from other sectors, including police, correctional officers, folks working in homeless shelters and elsewhere, and obviously many people in the public who would like this kind of equipment as well. So we have tasked Deputy Minister Paul Winnick, who oversees the Alberta Emergency Management Agency, with coordinating extraordinary procurement efforts for equipment like that, like face masks, and also to come up with a process for its distribution. First of all, to priority folks in the public service sector. So we're going to be doing our best to, and part of that involves, as I said, domestic procurement efforts. There have been a number of offers from manufacturers here in Canada. So Deputy Minister Winnick will be briefing Cabinet on those efforts this Friday.
Operator, can you please put through the next caller?
Next question is Emma Graney with the Globe and Mail. Go ahead, Emma.
Yeah, g'day. Thanks for taking my question. Now, I've got a question here about the increased powers for peace officers and also police officers as well. I understand they need to have them now, but when will Alberta see those powers dialed back? How will they be dialed back, particularly given our motto here is strong and free? Thanks.
Well, I'll start by saying that we'd actually do, let me just be clear, as I said in my statement, the powers are being ordered by the minister under the extraordinary authority he has through the declaration of a public health emergency. However, to your point, we do believe that any expansion of police powers should be ultimately subject to legislative authorization by the elected representatives of Albertans, which is why we will be proposing amendments to the relevant statutes in the legislature in the days to come. We have an understanding with the opposition that we can and should sit in the legislature on an extraordinary but limited basis to deal with emergency legislation as it arises. This will be one such piece of legislation, and perhaps we'll consider putting a sunset clause on these enhanced powers. But clearly, it's not our intention to use these except in the most extraordinary circumstances. Tyler, would you like to complement that at all?
Sure. I think that the administrative monetary part is incredibly needed anyways for the Public Health Act, and that likely would continue even after our response to COVID-19. The idea of including police officers and community peace officers is also being able to impose fines under the Public Health Act. As Premier said, I think that's something that will need to be considered and debated in the legislature.
All right, two more from the phones, and then we'll come back to the floor. Operator, can you put through the next caller, please?
Next is Graham Thompson with iPolitics. Go ahead, Graham.
Premier, you've seen what happened in Ottawa with the passage of the bill. There was some questions from the opposition who get balked at the idea of giving the Trudeau government more powers to raise taxes unilaterally. Do you think the Trudeau Liberals were trying to do an end run around Parliament by doing that?
Well, that certainly was the intention of those provisions. But I think, to be honest with you, I spoke to some senior members of the Trudeau government, and they said they said that they were not fully aware that those powers were embedded in the original version of the bill, and that as soon as they realized that, they pulled them back. So I think that's a good example of how Parliament should function, which is to say the opposition closely studied the bill. They saw some truly extraordinary powers. They brought that to the public's attention. The government realized it was an overstep and quickly corrected its course. So I think that's a good example of parliamentary democracy working well. I think that the notion of seeking a 21-month period during which the government could impose any kind of tax or spend any money on anything with no limit and no parliamentary approval was pretty obviously overreach, and I commend the government for recognizing that. And you know what? I don't want to turn this into a political football, because I understand from our own experience here, day to day, we are in crisis management mode. Things are moving extremely quickly. A big emergency bill like that would have been put together by dozens of people in multiple ministries, working around the clock, and it's always possible that that something hasn't received proper scrutiny. So we're all moving very fast, and I think that the public generally should be patient with political leaders at all levels and across the political spectrum as they try to sort through these issues. But there is a need for oversight and accountability, which is, for example, why we are committing to come to the legislature to make the amendments to give effect to statutory effect to what the minister is ordering today.
Operator, can you please put through the next caller?
Next caller is Mirna Juchik with Radio Canada. Go ahead, Mirna.
Hello, the question is for the Premier. Monsieur Kenny, en français, s'il vous plaît. Si vous pouviez nous expliquer pourquoi c'est important de donner des pouvoirs additionnels à ces agents de la paix et à ces policiers, et quelles sont les limites de ces pouvoirs, s'il vous plaît.
Oui, effectivement, il y a trop de personnes qui ne respectent pas les règles qui ont été imposées par le Dr Hinshaw, qui refusaient de faire l'isolation après ce qu'ils arrivent au Canada d'outre-mer. Et nous croyons que c'est essentiel que nous soulignions que c'est une obligation légale avec les peines sérieuses, avec l'enforcement des policiers, s'ils refusent de respecter ces règles pour la santé publique. Parce que si les gens arrivent, par exemple, si les gens ils ont les symptômes de cette maladie, s'ils arrivent de l'étranger, mais ils circulent dans la grande population, ça représente une menace aux santé publique. C'est les raisons pour lesquelles... Et je crois que ces nouveaux pouvoirs sont tout à fait raisonnables. C'est les frais de $1,000, par exemple. Je crois que ça, c'est tout à fait raisonnable.
Okay, we'll come back to the floor. Janet?
So some provinces have thus far declared a provincial emergency. What in Alberta do you think would prompt you to declare a provincial emergency under the Emergency Management Act?
Well, so far we have not seen the conditions that would justify a general declaration of emergency in Alberta. One of the only relevant powers we would have would be to close the borders of the province. We cannot close the international borders under international law and our constitution, but we could only close our interprovincial and territorial borders. We may, if it becomes necessary, consider screening people entering Alberta from Saskatchewan, BC, and the Northwest Territories. I note that Albertans going into the territories are now being screened. Quebecers going into New Brunswick and New Brunswickers going into Nova Scotia are being screened. So we do see some of that interprovincial screening happening. We do not need an invocation of a public emergency to do that. That is an option. And we would only do it if Dr. Hinshaw and her team were to recommend that. But at this stage, we do not see any compelling need to make a general declaration of emergency.
Dean?
Question for Dr. Hinshaw. Multiple parts. Sorry, I didn't hear a community transmission number from you off the top. That would be one. But I'm just wondering about your testing priorities. You said you'd be reevaluating those as you go. Mm-hmm. I noticed we went from almost 3,000 tests to less than 1,000 today. Mm-hmm. I don't know what's that reflective of. Also, we're looking at about 60% of the cases are in Calgary, but only 30% of the tests have been done. I'm wondering if that's a concern and whether you're going to rectify that. Multiple questions.
All right, I'll do my best.
He's very good at that.
So was the first question about the community numbers. So 33 of our total cases to date, which is 5 more than yesterday. Okay. Then there was a question about testing priorities.
Why we dropped quite a bit from one to the next.
So today was the day the lab was expecting a shipment of reagent. So I'm not sure. I haven't spoken to the lab directly, But I know that they had anticipated that over sort of yesterday and today, they may be kind of at the end of that one reagent supply. Today was the day they were getting more. So that's possible that that's why those numbers were low. I also know that when we announced the change to our testing priorities, one of the reasons we did that was we had quite a few swabs that had been taken and the lab hadn't been able to process them. I know I've heard people expressing concern about how long it's taken to get test results sometimes. And so we actually have implemented this in 2 stages. So the first part on Monday was to really turn down that testing and returning travelers, allow that backlog to move through. And tomorrow is going to be the implementation date for the healthcare worker screening. In addition, I want to be clear, we've already been doing testing in long-term care, testing of hospitalized patients. We have been continuing all of that, but the expanded healthcare worker screening is likely to be implemented tomorrow. So again, it could be a combination of those factors why the testing results are a little lower today, because we've been moving through that backlog, working on gearing up, and then have that reagent coming in today. And you had a final question.
It was just strange to see 60% of the cases in Calgary, but
in
only
Calgary.
30% of the testing. Is that indicative of anything that concerns you?
So we know that in Calgary there have been at least one significant cluster of transmission where we have quite a few cases from one event and then quite a bit of spread from those cases to secondary cases. So sometimes when we see a number of cases that are in a smaller volume of testing, it's because we're actually testing those close contacts of confirmed cases and they have a higher likelihood of being positive. But I don't think that the numbers are indicative of any difference in terms of community risk, because again, it's really been about returning travelers that we've been testing so far, and again, those close contacts. Once we start to get more information as we unfold this more community-based testing, that will give us a better idea of what's happening in different communities and that local level of risk. But at the moment, I wouldn't differentiate between Calgary and Edmonton with respect to what we're seeing in terms of community transmission.
Julia?
I'd just like to go back to that adult group home that you were talking about right off the top in terms of the outbreak. Can you just go over those numbers again, how many people are in that group home, and whether you know the source of that outbreak here?
So this was another outbreak that was identified late last night. So this is another example of where we're letting the public know what's happened, but we don't have all the information yet about the source of the outbreak, kind of where it might have been brought into that setting. We know that there's one staff member and 2 residents in one particular house. So this is a group home that has multiple houses across a particular area, and it's only in one of those houses that there are these 2 cases. And so right now the investigation that's happening is to determine whether or not any of the staff members, the one staff member who is a confirmed case, whether there's potential exposures to other houses, are there other staff members who are ill, and that's all information that's being investigated today, so I don't have those details.
Go ahead.
We've heard, I'm not sure if this is true or not, I'm hoping you can confirm, but we've heard that the directive for senior facilities is to treat in place, which I understand means if residents in that facility become sick or test positive, they're told to stay there, keep them comfortable until they either die or recover, and AHS is not to take them into acute care. Can you confirm or deny this? And if it's true, could you explain why?
So I will maybe ask Dr. Jaffe to speak to that. I'll just say quickly that my understanding is that generally of what a treat-in place direction would mean. So I would ask Dr. Jaffe, I'm not sure of the AHS decision on this, but in general, my understanding is that it would be to respect the wishes of clients. So if an individual who's a resident of a long-term care has expressed wishes in terms of an advance directive that they don't wish for extraordinary measures to be taken, and if that individual did get ill and was to become seriously ill, if they themselves had already said, I don't want extraordinary measures to be taken, there would be no benefit in moving that person to a hospital if they didn't want that to happen. So my understanding of that treat-in place is not that it's refusing care, but rather that it's expressly considering the wishes of individuals. But maybe I'll ask Dr. Jaffe to speak to the AHS part of this.
So thank you. The reality is that most Albertans who acquire COVID-19 will in fact be treated in place. They'll stay home. They'll stay in their usual place of residence, and the same thing would hold true for those in long-term care facilities or continuing care facilities. Ultimately, it is the judgment of the staff and physicians who supervise the care in those facilities to determine whether they think an individual would benefit from a transfer to hospital. There's been absolutely no direction from Alberta Health Services not to transfer. But as Dr. Hinshaw stated very clearly, it's important for each resident in long-term care and their families to make decisions about what kind of care they would like, what they would see for themselves at the end of their lives, whether they would prefer to spend, if they are their last days, whether they would prefer to spend them in their home, which may be the long-term care facility, or would they want to be transferred to hospital. Remember that there is no specific treatment for COVID-19, so there is no specific therapy that would be offered if an individual arrives at hospital. What we can do is we can support life with life support systems if individuals require it, and ultimately if they would truly benefit from that care.
Okay, we'll take...
Maybe just say one additional thing, just to follow up on what Dr. Jaffe said. To be clear, even though older individuals have a higher risk of severe disease and death, that does not mean that every older individual will go down that road. So just to be really clear about that first part of what Dr. Jaffe said is, even if someone is in a long-term care and does get infected, they may have a mild illness and they may not require any additional care. So just wanted to follow up on that.
We'll take two more from the phone, and then the Premier has a brief statement to make. Operator, can you please put through the next caller?
Yeah, first question is Jason Keller with the Globe and Mail. Go ahead, Jason.
Hi, this is for the Premier. We've reported this morning that the province is figuring out a list of essential workers, presumably in the event of a shutdown like we've seen in Ontario and Quebec. So how close are we to something like that in Alberta, and what is the current thinking in terms of if or when we would need to go down that road?
Well, I said it, I think in response to an earlier question, that we have been working diligently on developing a list of what constitutes critical infrastructure and essential services. We were briefed on an initial proposal by the Alberta Emergency Management Agency this morning, and they're going to do further work. I anticipate that by early next week we will have settled on a criteria and a list of essential services. We've been looking closely at what other jurisdictions do, including Ontario, Saskatchewan, some U.S. states, including Massachusetts, as a template for our own list. Obviously, Alberta's economy has some unique characteristics, one of which is our large energy sector. As I've said before, I raised with Prime Minister Trudeau when this all began over 2 weeks ago that the continued operation of certain oil sands infrastructure is essential, because if some of those SAGD projects shut down, that permanently risks their reservoirs and billions of dollars of investment and a critical part of the Canadian economy. So our list will be more expansive than others in areas like energy production, but I think it will probably end up being quite similar to that of Ontario or, say, Massachusetts.
Operator, can you please put through the next caller?
Yeah, next question is Jason Herring with Post Media. Go ahead, Jason.
Hey there, Dr. Hinshaw. The only number that we've heard so far for recoveries is 3. Can you explain why that number hasn't changed since the weekend, as well as what the process is that must be completed before a COVID patient is said to have recovered?
Sure. So part of the reason that our number is still at 3 officially is because we recognize that using our lab tests to determine when someone has recovered from the virus is not a good use of, again, we have a certain number of lab tests we can do, and we felt that was not a good use of those tests when we know that, again, the evidence that I discussed yesterday, someone who has very mild symptoms will not be able to pass that virus on to others after 10 days from the start of their symptoms. So the piece that we're trying to figure out is, without having those lab tests come through our administrative databases, we're really relying on the local public health teams to be letting us know when those individuals who've been confirmed to be cases of COVID have cleared their symptoms. So again, to be clear, it's 10 days or the resolution of symptoms, whichever takes longer. So because that's a bit more labor intensive to figure out, we really are waiting for a better process so that those local public health teams are able to efficiently let us know when someone has met those criteria. And as you can imagine, with the number of new cases we're getting every day, local public health teams are incredibly busy, and their priority is really following up on those individuals who are new cases and determining close contacts and putting that isolation and quarantine, or the self-isolation in place around those people. So that's taking a little while to get a good administrative process flowing for those recovered numbers, but we are working on that, and I anticipate, again, within the next several days, we'll be able to have a more accurate representation of those recovered numbers.
Great. The Premier has a statement to make.
Right. Sorry, just a little update. I meant to include in my opening statement just to say that the special isolation payments that we announced last week are now open for application at alberta.gc.ca, and these are payments available of $1,146. If they are required, if people are required to self-isolate, or if they are the sole caregiver of someone in self-isolation, and if they have no other source of income or compensation. So the criteria are very clear on the website. The criteria include people who have been diagnosed with COVID-19, have been directed by health officials to self-isolate, or are also the sole caregiver of a dependent who is in self-isolation. I understand that as of by 2 o'clock this afternoon, several thousand people had already applied, and the website effectively crashed because of the surge in demand. But I understand that Service Alberta will have it up and running again with expanded capacity. So I just wanted to ask people to be patient as we cope with the overwhelming demand. And I just want to remind people that this is not intended to be a long-term income replacement program. It's simply an interim cash payment for people who are in isolation, who have no other income, until they qualify for the expanded federal benefits, which were announced last week and which have been expanded in legislation adopted by the federal parliament earlier today. Thanks very much.
Hi, everyone. Thank